Chapter 14 Mindtap Part 2, After Class. Question 1a. Engagement activity. Stress and sex. What type of stress affects sexual behavior the most? There is a general assumption that stress has a negative impact on sexual functioning. However, little empirical research has been conducted to investigate this topic. Experiments have often focused on the effects stress has on relationship quality and functioning, but not specifically on sexual dysfunction originating from stress. The current study explores the unique effects of internal versus external stress, categorized as major or minor in nature. Read this excerpt from the stress experiment, and answer the questions that follow. Question 1a. Excerpts. Method. Participants for this study were 198 couples with a mean relationship duration of approximately 12 years. Each set of couples was mailed a packet of questionnaires that included separate and distinct materials for each partner, together with instructions to complete the questionnaires independently from each other and return them to the experimenters within 2 weeks. The questionnaires included assessments of the following variables for the previous month: amount of daily hassles, major stressful life events, relationship quality, sexual problems, and sexual dysfunction. Internal stress was defined as stress originating from within the relationship, whereas external stress was defined as stress originating from outside the relationship. The category of major stress included critical life events such as illness, unemployment, or death. The category of minor stress included everyday hassles such as traffic, being late, or forgetting your lunch. Results. Internal stress had a stronger relationship with sexual dysfunction than external stress. Minor. Internal stress was associated with 9% to 26% of the sexual problems reported by the couples and up to 47% of the specific sexual dysfunctions reported. Specific sexual dysfunctions included sexual desire problems, sexual aversion, and premature ejaculation. Minor. External stress had no effect on sexual dysfunction. Question 1a. Based on the findings of the research, which of the following can you assume would have the greatest negative impact on sexual behavior in a relationship? One person in a relationship feels like he or she always does the dishes, loses his or her job, has a long commute, feels depressed after the death of a loved one. It's A. Feels like he or she always does the dishes. Explanation. The results from this study show that minor internal stress has the greatest negative impact on sexual behavior between couples. Internal stress is any stress that originates from within the relationship, and minor stresses are those that originate from everyday occurrences. One person in a relationship feeling like he or she always does the dishes is the only example that originates from both within the relationship and from an everyday occurrence. The death of a loved one, a long commute, and losing one's job all originate from outside the relationship, meaning that they won't have as big an impact on sexual behavior. Question 1b. According to the research, which of the following strategies should therapists employ to help couples reduce the negative impact that stress can have on their sex life? Focus on improving communication and conflict resolution between a couple. The sources of conflict observed in the relationships between each individual's parents. Relaxation techniques that help couples deal with work-related issues. General stress management techniques to improve each person's life coping skills. It's A. Improving communication and conflict resolution between a couple. Explanation. Based on the findings from the research study, helping couples manage minor internal stress is most likely to have a positive impact on their sexual behavior. Improving communication and conflict resolution skills between couples is the only choice that pertains to minor internal stress. The other strategies are all aimed primarily at dealing with external stress, like that which arises from work or dealing with other family members. According to the research, this type of stress had no negative impact on sexual behavior, meaning that these strategies probably won't lead to the development of skills that reduce the negative impact that stress can have on sexual behavior. Question 2a. Health psychology. Health psychology is an emerging field in the medical community. Health psychologists work alongside other medical staff to advocate for a change in the traditional view of physical illness. The graph below presents data related to health. Using the blue rectangle labeled health psychologist, highlight the additional data a health psychologist would consider that other medical professionals might not, when addressing the forces most likely to contribute to the cause of illness. Graph tool tip. Highlight the entire row of data and expand the blue bar so that it covers the selected row from top to bottom. Your response may be marked as wrong unless the full area of the row is covered by the blue bar. Here is the graph. Explanation. Health psychologists, as compared to other medical professionals, would be more likely to advocate for the consideration of a person's daily income. Health psychologists believe that biological phenomena alone, such as blood pressure or heart rate, should not be the only focus when considering physical illness. In this emerging area of psychology, psychosocial factors are important when attempting to maintain, understand, or measure a person's well-being. Psychosocial factors include a person's thoughts, personality, attitudes, and environmental conditions. Question 3a. The nature of stress. Which stressors are everyday events that you perceive as threatening? Researchers believe that this type of stressor is important to understand because of the nature of stress. Minor stressors are everyday events that you perceive as threatening. Researchers believe that this type of stressor is important to understand because of the cumulative nature of stress. Explanation. Minor stressors are everyday events that you perceive as threatening, and they are important to understand because of the cumulative nature of stress. Everyday hassles can be abundant, and if you find every one of them threatening, you can become overwhelmed by cumulative stress. Question 3b. The following life events were experienced by Nsedisi and Naledi in the past year. Researchers have compiled the Social Readjustment Rating Scale, SRSS, in order to gauge the magnitude of stress a person has recently experienced. Between Nsedisi and Naledi, who has experienced the most change-related stress? Nsedisi's recent promotion at work came with a number of new responsibilities, and he quit the choir at church to be more involved with the youth programs. Naledi's spouse made major efforts towards reconciliation of their marriage, and she has been troubled by in-laws recently. There are 4 principal types of stress, and not all have received equal amounts of attention from researchers. Recently, the research attention given to pressure has begun to increase. One implication of the new findings on pressure is that people might actually have over the stress in their lives. It's Naledi. Naledi's spouse made major efforts towards reconciliation of their marriage, and she has been troubled by in-laws recently. Explanation. Naledi is correct. Using the Social Readjustment Rating Scale, you need to identify the amount of life change units associated with the life events experienced by both Nsedisi and Naledi. Nsedisi's life events fall under the categories of a change in responsibilities at work, 29 life change units, and a change in church activities, 19 life change units. Naledi's life events fall under the categories of marital reconciliation, 45 life change units, and trouble with in-laws, 29 life change units. Adding together the life change units for both Nsedisi and Naledi's life events, you can see that Naledi has the higher number. According to the creators of the Social Readjustment Rating Scale, Naledi's higher number of life change units means she has experienced more change-related stress. There are 4 principal types of stress, and not all have received equal amounts of attention from researchers. Recently, the research attention given to pressure has begun to increase. One implication of the new findings on pressure is that people might actually have more control over the stress in their lives. Explanation. New findings on pressure are showing that people might have more control over the stress in their lives. Researchers are beginning to advocate that people begin to understand the ways in which they can influence the amount of stress they feel. Question 4a. Conflicts occurs when you have to choose between 2 competing demands. There are different types of conflict, and how you perceive the competing demands determines the type of conflict you encounter. Identify the correct type of conflict from the given description. Conflicts description. Conflicts that involves more than 2 demands, which all have positive and negative aspects. Conflict that occurs between 2 negatively interpreted demands. Conflict that occurs when a single choice has both positive and negative qualities. Explanation. Approach conflict having to choose between 2 alternatives that are each viewed as attractive, likable, or positive. Avoidance conflict having to choose between 2 alternatives that are each viewed as negative or undesirable. These conflicts often result in freezing or leaving the field. Approach avoidance conflict having to choose whether or not to pursue a single goal that has both positive and negative attributes. These conflicts often result in feelings of ambivalence or a partial approach response. Multiple approach avoidance conflicts, having to choose between options that all have positive and negative qualities. Question 4b. The following scenario outlines a strategy Dr. Singh is using to help students identify the differing types of conflict. Dr. Singh assigns his students the task of identifying a choice they have to make that involves conflict. They are to make a list of the positive and negative aspects of the decision to be made. After making their lists, the students are to add up the number of positive and negative aspects to making a choice and represent their findings graphically. The following graphs represent possible data for one student, Kulia. After making her list, Kulia identifies her conflict as an avoidance conflict. Identify which graph accurately portrays her results. Explanation. Graph 2 is correct. Avoidance conflict occurs when both competing demands have more negative than positive aspects. Graph 2 illustrates this trend. These types of conflicts can produce indecision, as someone tries to avoid both possibilities. In situations where a decision is necessary or required, it often comes down to choosing the lesser of two evils. Question 5b. Identify which statement accurately characterizes the typical coping profiles for men and women. Women are more likely than men to use withdrawal coping strategies. Men are more likely than women to use withdrawal coping strategies. Women are more likely than men to use active coping strategies. Men are more likely than women to use active coping strategies. Based on the trends in the previous typical coping profiles, which of the following is most likely true? Women and men are equally likely to seek clinical guidance to deal with a stressful situation. Women are less likely than men to seek clinical guidance to deal with a stressful situation. Men are less likely than women to seek clinical guidance to deal with a stressful situation. It's B. Men are more likely than women to use withdrawal coping strategies. Explanation. The results from this survey show that men are more likely than women to use withdrawal coping strategies, and women are more likely than men to use active coping strategies. This means that the men in this study are more likely to use strategies that allow them to avoid dealing with the stressful situation, and the women are more likely to take action to deal with the stressful situation. It's C. Men are less likely than women to seek clinical guidance to deal with a stressful situation. Women are more likely to use active coping strategies, talking with others or searching for relevant information, while men are more likely than women to use withdrawal coping strategies, behaving as if everything is fine or trying not to think about the problem. Therefore, it is reasonable to conclude that women are more likely than men to seek clinical guidance to deal with a stressful situation. Question 6a. Emotional responses to stress. Contrary to popular belief, positive emotions do not simply disappear in times of stress. Rather, they play a key role in helping people bounce back from stress. One reason positive emotions promote resilience is their ability to help in building. Researchers have found that emotional arousal is a necessary component of life, and may even have beneficial effects for performance. The inverted U hypothesis predicts that performance on a task will improve with increased emotional arousal, but only up to a point. Depending on the task at hand, too much arousal can become disruptive and hinder optimal performance. The graph below illustrates one way in which a change in level of arousal will affect performance level. Using the blue line provided, bisect the graph at the optimal level of arousal. Tool tip: after placing one of the dots on the line at the correct point on the graph, rotate the line so it vertically bisects the graph. It's a. Contrary to popular belief, positive emotions do not simply disappear in times of stress. Rather, they play a key role in helping people bounce back from stress. One reason positive emotions promote resilience is their ability to help in building social support. Explanation. One of the ways researchers believe positive emotions help a person bounce back from stress is by motivating a person to be involved in rewarding social interactions, and to build the necessary social support to get through the stressful times. Findings continue to show the biopsychosocial benefits that accompany positive emotions. Explanation. The optimal level of arousal is the level of arousal at which performance peaks. You need to place the line at this point on the graph. Question 6b. Depending on the task at hand, your optimal level of arousal will fluctuate. The graph above illustrates Andile's level of arousal while performing a task. Identify the scenario that most likely describes the task that was at hand for Andile. Scenario 1. Sweeping the floors in the kitchen. something he has done every Friday for the past 5 years. Scenario 2. Putting together furniture and watching television. It only has 7 pieces and comes with directions. Explanation. Scenario 1 is correct because it is the scenario that describes the task with a low level of difficulty. In the graph above, Andal's performance peaked at a relatively higher level of arousal. According to the inverted U hypothesis, a relatively higher level of arousal is optimal for simple tasks. You need to choose the scenario that describes a more simple task. Question 7a. Physiological responses to stress. Hans Selye is credited as one of the first scientists to raise concern over the potentially detrimental effects of stress. Early in his research, he began to find a specific pattern of response in stress reactions, no matter the type of stress. Selye explained this pattern of response in terms of the general adaptation syndrome, or 3-stage model of the body's response to stress. Identify the correct description for the given stage. Stage description: alarm reaction stage, stage of resistance, stage of exhaustion. Explanation. The following are accurate descriptions for each stage in the general adaptation syndrome. Stage description: alarm reaction stage, the first stage of the general adaptation syndrome. Stage of resistance, the second stage of the general adaptation syndrome. Stage of exhaustion, the third stage of the general adaptation syndrome. Question 7b. Dr. Adabi is a researcher in a stress clinic and is monitoring her clients' levels of resistance on a weekly basis. Most of her clients are under extreme stress from work, and they show patterns of response similar to those found in the general adaptation syndrome. The following graph portrays results for Philony, one of Dr. Adabi's participants. Question 7b. After leaving Dr. Adabi's clinic one day, Philony meets a friend for lunch and tells him about all of the stress he has been encountering with work. Philony talks about feeling physically drained from all the stress. Using the graph, identify the week when what Philony is describing most likely occurred. Week 50, week 5, week 30. Explanation. Week 50 is correct. Philony's description includes details that describe events that most likely took place during the third stage of the general adaptation syndrome. Stage of exhaustion. During this stage, a person's ability to cope with a stressful event decreases significantly, and physiological damage to the body begins to occur. Philony's description of feeling the physical effects of being exhausted by stress matches the definition for the stage of exhaustion. As seen on the graph, Philony's level of resistance is lowest at week 50, suggesting his body has succumbed to prolonged stress. Question 8a. Brain-body pathways and stress. Physical responses to stress originate in the brain. As with other forms of brain-body communication, there are specific communication pathways to prepare our bodies to face stressors. Francois is sitting in traffic on the way to work and is starting to have feelings of stress. The following hierarchy is an illustration of the communication occurring between Francois' brain and body the moment he appraises the situation as stressful. First, identify the missing components in the sequence. Explanation. Once a person appraises an event as stressful, the body takes action. This action begins with the hypothalamus activating 2 separate pathways. One pathway travels from the hypothalamus to the sympathetic nervous system to the adrenal glands. Hormones are then secreted that prepare the body for action. The other pathway travels from the hypothalamus to the pituitary gland to the adrenal glands. This pathway signals the release of stress hormones that protect the body from injury and act as natural painkillers. The combined effects of these 2 systems prepare the body to respond to stress. Question 8b. Second, identify the scenario that most likely results from Francois' brain-body activity. Scenario 1. Francois feels his blood pumping through his veins and wants to run to work. Scenario 2. Francois turns around to go home and has to turn up the volume of the radio to keep from falling asleep. Scenario 3. Francois passes out in his car. It's scenario 1. Francois feels his blood pumping through his veins and wants to run to work. Explanation. The most likely result of Francois' brain-body activity is that he feels his blood pumping through his veins and wants to run to work. Hormones secreted by the adrenal glands, a component of the endocrine system, travel to major organs, the liver, heart, lungs, and prepare the body to respond to stressors. To respond, the body needs a surge of energy supplies. The major organs are directed to increase heart rate and lung capacity and release energy supplies stored in the liver. Francois's brain-body activity is least likely to result in a decrease in activity, passing out or falling asleep. Question 9a. Behavioral responses to stress. Behavior is a common component of the ways in which you respond to stress, and can lead to either productive or unproductive ways of dealing with stress. First, let's focus on the ways in which coping with stress in a behavioral form can be detrimental. Complete each of the following scenarios so that the description matches the type of coping provided. Striking out. Cobus is bothered by all the noise at his workplace. He can't get his work done, and comes home every day in a bad mood. Today the noise level was especially bad, and when he got home he. Defensive coping. Tasneem has been diagnosed with a rare form of cancer. The doctor is informing her that there is a chance it could be terminal, but she. Cobus is bothered by all the noise at his workplace. He can't get his work done, and comes home every day in a bad mood. Today the noise level was especially bad, and when he got home he yelled at his wife during a minor argument. Explanation. Striking out. This type of coping involves acting aggressively towards others. Cobus acting aggressively towards his wife most accurately matches this definition. Researchers have found that this type of coping actually increases aggressive tendencies, and does not create a cathartic effect. Defensive coping. Tasneem has been diagnosed with a rare form of cancer. The doctor is informing her that there is a chance it could be terminal, but she refuses to believe this fact. Explanation. Defensive coping. This type of coping involves the use of defense mechanisms in order to distort reality. Tasneem distorting the reality of her possibly terminal cancer most accurately matches this definition. Researchers have found that this type of coping rarely involves the actual resolution of a problem. Question 9b. Now that you can recognize detrimental forms of coping, let's review constructive coping habits. The following scenario has been presented to you by a friend. Peter, a first-time home buyer, is trying to find a house to buy. He has found a real estate company that he would like to work with, and has been assigned to an estate agent. He has seen a number of properties that the estate agent thinks he would like, but they are not what he is looking for. He has tried to talk to the estate agent about this, but she doesn't seem to understand. She keeps showing him the same houses. He doesn't want to seem rude, so he goes to see the houses with the estate agent. He always leaves feeling like all of this is a waste of time, and is becoming resentful towards the estate agent. If your goal is to foster constructive coping, identify which of the following statements you would offer to your friend as advice. Check all that apply. You should just stop showing up to the showings and make the estate agent realize how being resentful feels. You might want to start seeing a therapist to find out why you are having problems getting along with other people. You might want to take a break from viewing houses, and give your body a period of relief from all this stress. You should realize that becoming resentful is not good for your health. Explanation. Advising your friend to realize that being resentful is not emotionally healthy, and to realize the potential for physical damage from stress are the pieces of advice that will foster constructive coping. Constructive coping involves the following. A. Confronting problems directly. B. Realistically appraising stress and coping resources. C. Learning to recognize unhealthy responses to stress. And D. Preparing the body to reduce the potential for stress to cause physical damage. Advising your friend to realize that being resentful is not emotionally healthy is an example of learning to recognize unhealthy emotional responses to stress. Advising your friend to realize the potential for physical damage from stress is an example of preparing your body to protect against potential physical damage. Utilizing these strategies does not ensure a successful outcome. Rather, it gives you a guide that tends to lead to success in dealing with stressful situations. Question 10a. Engagement activity. Accelerating the coping process. Managing stress. Does writing help? Research has consistently supported the notion that stress can have a negative impact on physical and psychological health. A source of stress for many people centers around the transition of entering university. This period of adjustment can involve coordinating living arrangements and managing a demanding schedule, all while seeking to study at a higher level. Inasmuch as these competing demands are likely to impact one's health, what is a good way to cope in this situation? Read the research summary investigating this topic and answer the questions that follow. Question 10 Excerpts Method. Participants for this study were 130 students starting their first semester of university. Each was randomly assigned to the control group or experimental group. For 3 consecutive days, each group was instructed to write for a 20-minute period, with the writing topic different between the 2 groups. Participants also periodically completed questionnaires to gauge their psychological well-being throughout the semester, along with giving researchers permission to access their health center records. The experimental group wrote about their deepest thoughts and feelings pertaining to entering university. The control group wrote in detail about what they had done during the day previous to their appointment with the experimenters. They were specifically asked to write about things as they occurred, without mentioning emotions, feelings, or opinions. At the end of the semester, the experimenters obtained the health center records of the participants and an unidentified, random sample of non-participating first-year undergraduates. These records provided the reason, date, and number of visits made for a particular issue. Results: health center visits for illness among participants in the experimental group were fewer than visits for illness for the control group. Health center visits for the random sample of students not participating in the study fell midway between the number of visits for the experimental and control groups. Psychological well-being scores for participants in the experimental group dropped from the beginning to the end of the semester. Scores for participants in the control group illustrated a slight increase in well-being. Upon analyzing specific answers from the well-being questionnaires, participants in the experimental group were more homesick and more worried in general about university, indicating a decrease in well-being for the experimental group. Question 10a. Which of the following statements accurately characterizes the physical impact of using the written coping strategy? The control group had less health center visits, indicating a physical benefit of not writing about one's thoughts and feelings. Both groups had the same number of health center visits, indicating the written coping strategy had no physical impact. The experimental group had more health center visits, indicating a negative physical impact of writing about one's thoughts and feelings. The experimental group had fewer health center visits, indicating a physical benefit of writing about one's thoughts and feelings. Which of the following statements most likely characterizes the psychological impact of using the written coping strategy? Writing about or not writing about one's thoughts and feelings had the same positive impact on psychological well-being. Writing about one's thoughts and feelings caused heightened awareness of the stress, negatively impacting psychological well-being. Not writing about one's thoughts and feelings caused decreased awareness of the stress, negatively impacting psychological well-being. Writing about one's thoughts and feelings created a sense of having coped with the stress, positively impacting psychological well-being. The experimental group had fewer health center visits, indicating a physical benefit of writing about one's thoughts and feelings. Explanation. Health center visits for illness among participants in the experimental group were fewer than visits for illness in the control group. This should have led you to infer that writing about one's thoughts and feelings pertaining to the stress of entering university, as the experimental group did, was more physically beneficial than writing about daily activities, as the control group did. Writing about one's thoughts and feelings caused heightened awareness of the stress, negatively impacting psychological well-being. Explanation. Psychological well-being among the experimental group dropped from the beginning to the end of the semester, with the control group showing slight improvement in well-being across the same time frame. This decrease in well-being in the experimental group should have led you to infer that writing about one's thoughts and feelings might actually prompt a person to ruminate, or think about, the source of stress more, negatively impacting psychological well-being. Question 10b. What do these combined results mean for the coping strategy of writing about one's thoughts and feelings surrounding a stressful event? The benefits to physical health outweigh the benefits to physical health are equal to the benefits to psychological health occur at the expense of physical health occur at the expense of psychological health. It's D occur at the expense of psychological health. Explanation. The physical benefits for the experimental group, reduced visits to the health center, were a result of writing about one's thoughts and feelings surrounding entering university. Unfortunately, these physical benefits came at the cost of psychological health. The psychological well-being of this group decreased from the beginning to the end of the semester. Question 10c. For administrators hoping to lessen the physical and psychological impacts of stress associated with entering university, which of the following advice would you give after reading this study? Increase the availability of therapists at a campus mental health facility after advising students to not write about their thoughts and feelings. Motivate students to write about their thoughts and feelings when entering university, but offer an additional coping strategy to deal with the psychological impact. Advise students to write down their thoughts and feelings when entering university, but increase hours at the health center. It's B. Motivate students to write about their thoughts and feelings when entering university, but offer an additional coping strategy to deal with the psychological impact. Explanation. Overall, these findings illustrate that writing down thoughts and feelings about entering university has a positive impact on physical health and a negative impact on psychological health. As a result, the best advice for school administrators is to motivate students to write their thoughts and feelings about entering university for the benefits to physical health, but offer an additional coping strategy to counteract the negative psychological impact this activity creates. Not writing about one's thoughts and feelings leads to an increase in health center visits but increased psychological health, so advising this option with an increase in the availability of therapy is not a good solution. Students not writing about their thoughts and feelings showed a positive impact on their psychological well-being, thus making increased therapy availability unnecessary for this coping strategy. Advising students to write about their thoughts and feelings should reduce their visits to the health center. Motivating students to cope in this way and offering increased hours at the health center is an ineffective strategy. Students who wrote about their thoughts and feelings visited the health center with less frequency, so increasing hours at the health center after motivating students to use this strategy would be unnecessary. Question 11a. Stress and psychological functioning. Severe or persistent stress can have a negative impact on psychological functioning, contributing to impaired task performance, burnout, and the onset of severe psychological disorders. Consider the scenario below and then answer the questions that follow. Dr. Ndaba is looking to identify good participants for her study on burnout. She collects information on several key variables from 3 employees at a local company, measuring the energy level of cynicism, and feeling of competence at work, using a scale from 0, low, to 10, high. The results are shown here. Is most likely suffering from burnout and would be the best candidate for Dr. Ndaba's study. This is because he or she has a level of cynicism, and a feeling of competence at work. Kirabo is most likely suffering from burnout and would be the best candidate for Dr. Ndaba's study. This is because he or she has a low energy level, a high level of cynicism, and a low feeling of competence at work. Explanation. Kirabo is most likely to be suffering from burnout because he has all of the characteristic features of burnout: high cynicism, low energy level exhaustion, and a low feeling of competence at work, lowered sense of self-efficacy. The other 2 employees only have 1 or 2 of the characteristic features of burnout. Question 11b. Dr. Ndaba developed a burnout reduction program based on the results of her study. If her program is effective, what is the likely outcome for a company that implements it? Decreased job commitment, decreased turnover, reduced productivity, increased absenteeism. Stress is not all bad news, however, because we know that stress can also lead to positive outcomes for a person. Kirabo is a new university student who also works full-time. He often feels overwhelmed by his busy schedule and many responsibilities. Although Kirabo may suffer some ill effects of stress, he may also benefit by its decreased turnover. Explanation. Workers who can avoid burnout are more likely to enjoy their jobs and remain at them. Thus, an effective burnout reduction program should see a reduction in turnover, increased absenteeism, reduced productivity, and decreased job commitment are all consequences of burnout and should change if the program is effective. Stress is not all bad news, however, because we know that stress can also lead to positive outcomes for a person. Kirabo is a new university student who also works full-time. He often feels overwhelmed by his busy schedule and many responsibilities. Although Kirabo may suffer some ill effects of stress, he may also benefit by learning good time management and coping skills. Explanation. Researchers note that stressful challenges can often lead a person to develop new abilities, such as time management and coping skills. Stress can also contribute to the development of a reduced attention span and insomnia, but these would generally not be considered beneficial for a person. There is no evidence that stress produces greatly enhanced memory functions. In fact, research suggests that stress can impair certain memory functions. Question 12a. Personality and health. Health psychologists are increasingly interested in how certain personality dimensions can affect health. From years of research, specific personality types have been identified to help researchers understand the dimensions of personality that are most likely to influence health. Identify the personality type described in each of the following scenarios. Scenario 1. Bongani just traveled with a friend for 13 hours only to be told that their hotel room is not available. They decide not to get upset but instead to unwind at the bar while the hotel staff attempt to find a solution. Type. Explanation. Scenario 1 describes a type B personality. Someone with a type B personality will often be described as easygoing, relaxed, patient, calm, and relatively friendly overall. Bongani deciding to not get upset and instead unwinding at the bar is representative of this definition. Question 12b. Scenario 2. Sarah once left a friend at an ATM because he was taking too long. Type. Researchers have identified what is considered a modest correlation between type A behavior and increased coronary risk. Of the main attributes to the type A personality, a strong link has been found between and an elevated incidence of heart disease. Explanation. Scenario 2 describes a type A personality. Someone with a type A personality will often be described as aggressive, competitive, impatient, hostile, angry, and as having a sense of time urgency. Sarah leaving a friend at an ATM for taking too long is representative of this definition. Researchers have identified what is considered a modest correlation between type A behavior and increased coronary risk. Of the main attributes to the type A personality, a strong link has been found between anger and hostility and an elevated incidence of heart disease. Points. 1. Recent research has not been as strong or consistent in finding a correlation between type A behavior and an increased coronary risk as earlier research. However, it has recently been found that there is a more toxic element to the type A personality, anger and hostility. Participants categorized as high in anger were more likely to experience a coronary event, resulting in the conclusion that reducing one's anger may be a heart-healthy endeavor. Question 13a. Stress and immune functioning. A number of researchers have found correlations between stress and illness. Draw a red line that bisects two of the blue points on the graph and represents the direction of the relationship between stress and the likelihood of becoming ill. Which of the following statements accurately characterizes the correlation between stress and illness? Check all that apply. The strength of the relationship between stress and illness is often in the 70s. Stress conclusively causes illness. The coefficient that corresponds to the relationship above is plus 1.0, a number much higher than the actual relationship between stress and illness. Stress is simply one factor among many that contributes to illness. Explanation. Researchers have found that with an increase in stress, the likelihood of becoming ill increases. Responding to stress requires energy from your body. Unfortunately, this energy is often removed from the immune system and reduces your body's ability to fight against disease. Explanation. You must be careful when drawing conclusions from correlations, and remember that correlation does not equal causation. You can assume that there is a relationship between stress and illness, while recognizing that stress is not the sole contributing factor. A third variable, or more, could be involved. Additionally, you are forced to create a perfect correlation. Coefficient equals plus 1.0 on the graph above. With a perfect correlation, an increase in stress would always be accompanied by an increase in the likelihood of becoming ill. Researchers know that people deal with stress differently, and that not all stress results in illness. As a result, the strength of the relationship between stress and illness is not as strong as what you created on the graph. The correlation between stress and illness typically falls in the 0.20s and 0.30s. Although these correlations are still meaningful and significant, these numbers imply a more modest relationship than the one illustrated above. Question 14a. Factors moderating the impact of stress. Researchers have identified a number of factors that create individual differences in how well people tolerate stress. Identify the person on the graph who is most likely to have a reduction in immune response. Explanation. Richard is correct because he has the lower level of social support. Researchers have found that a lack of social support, or social isolation, is more likely to be associated with reduced immune response. Question 14b. The following graph illustrates different tests of physical health for Liesel and Leduc. The results for each of their tests have been categorized as either low, optimal, or high. Those test results that fall in the optimal range are evidence of good physical health. Which of the following descriptions most likely characterizes the way in which Liesel's friends would describe her personality? Description 1. Liesel is constantly in denial when things go wrong, and is usually pretty pessimistic. Description 2. Liesel is good about calling us when feeling stressed, and even then is pretty optimistic. Explanation. Description 2 is correct. Liesel's physical health, on the graph above, falls in the optimal range. Researchers have found a relationship between optimism and relatively good physical health, or health in the optimal range. Since Liesel's health results do fall in the optimal range, you can assume that she would be described as more of an optimist. Optimists are more likely to deal with stress by engaging in problem-focused coping, seeking social support, and emphasizing the positive when appraising stressful events. Question 15a. Health impairing behavior. Many people throughout the world engage in health impairing behavior. Unfortunately, there can be fatal consequences associated with these behaviors. The following graph summarizes the total number of premature deaths per year and their associated causes. According to the graph, which of the following statements is true? AIDS makes up approximately 23% of the premature deaths associated with infectious diseases. Auto accidents are more dangerous than alcohol use. More people die prematurely from illegal drug use than from suicides. Explanation. Of the 75,000 premature deaths caused by infectious diseases, approximately 17,000 of these deaths are attributed to AIDS. Thus, AIDS makes up approximately 23% of the premature deaths associated with infectious diseases. 17,000,075,000 equals 0.227, or 22.7%. In South Africa, HIV/AIDS is the leading cause of child mortality. Further, although common sense might suggest that vehicle accidents are more common than deaths related to alcohol use, this is not true. Alcohol-related deaths are more prevalent at 85,000 deaths, and vehicle accidents comprise 33,800 premature deaths in the United States. In South Africa, some 60% of road deaths are alcohol-related. The World Health Organization, WHO, reports that South Africa has the highest rate of alcohol-related deaths on the road. Finally, more people die prematurely from suicides, 3,600 deaths, than from illegal drug use, 17,000 deaths. Question 15b. The following scenario illustrates the day-to-day life of a young person in South Africa. Note the risky behaviors that he or she is engaging in, then, given the information from the preceding graph, use the drop-down menus to rank the three behaviors, 1 to 3, with 1 being the most risky and 3 the least risky. Bokamozo is a 17-year-old student in high school. During the week, she participates in sports such as cycling and surfing. She is also active in extracurricular music activities. On Fridays and Saturdays, she spends most evenings with her friends drinking beer and spirits and occasionally drives home after she has had 3 to 4 drinks. Sometimes she also has a cigarette with her beer. She believes that her behavior is healthy because she exercises so much. Behavior rank: drinking alcohol, tobacco use, smoking, driving. The most risky of Bokamozo's behavior is something that she participates in, illustrating the nature of certain behavior patterns. Explanation. Tobacco use is the most dangerous risky behavior, and Bokamozo should stop smoking. Accidents rank second in the figure, but auto accidents specifically cause fewer premature deaths than those due to alcohol. However, note that Sarah drives while intoxicated, so more data may be needed. The most risky of Bokamozo's behavior is something that she voluntarily participates in, illustrating the self-destructive nature of certain behavior patterns. Points. 1. The most risky of Bokamozo's behavior is tobacco use, smoking, a substance that many people voluntarily choose to use. Unfortunately, use of this substance is self-destructive, due to the fact that it is common knowledge that use of this substance is bad for your health. Question 16a. Psychology and health researchers have realized that a person's physical health is influenced by a wide range of biological, psychological, and social factors. This integrated perspective is designed to provide a comprehensive, Thorough view of a person's health that examines several potential causes of illness or discomfort. Imagine that you are visiting a dentist because of persistent pain in your jaw. You are surprised when she inquires about your mental health status, so you ask why that's relevant. The dentist states that it's important to consider the factors that may be contributing to your condition. Explanation: your dentist is emphasizing the importance of understanding the psychological factors contributing to the pain in your jaw. Your dentist follows the biopsychosocial approach to diagnosing physical illness and believes in the importance of going beyond a biological emphasis. This approach incorporates psychological and social factors when arriving at a diagnosis. Question 16b. Dr. Zaba is a health psychologist and is attempting to treat Jana's illness. The following is a list of the factors Dr. Zaba has identified as integral to providing treatment for Jana. Identify the missing psychological factor that completes Dr. Zaba's list. Check all that apply. Social factors. Biological factors. 1. In a supportive marriage. 1. History of migraines. 2. Access to medical care. 2. Healthy cholesterol levels. Psychological factors. Check all that apply. Worries about the future. Liver damage from drinking. Uses emotion-focused coping recognized by community for volunteer efforts. Explanation: uses emotion-focused coping and worries about the future are correct. These accurately characterize psychological factors for Jana. Psychological factors are those that include a person's thoughts, feelings, and behavior. Biological factors are those that pertain to a person's physiological functioning. Social factors are those that pertain to a person's environment. Question 17a. Albert Ellis's model of emotional reactions. Most people associate their emotional turmoil with a stressful event. However, Albert Ellis argues that it is actually one's thought process in response to a stressful event that leads to the emotional consequence. The following conversation takes place between Cobus and his daughter, Naledi. Keep in mind Ellis's ABC model of emotional reactions while reading Naledi's responses. Cobus: what is wrong? You seem to be having a bad day. Naledi: I failed my history exam, and I'm stressed that I will not be allowed to progress to next year. Cobus: I thought we agreed you were going to start doing better at university. Naledi: I tried, but this exam was really hard. Cobus: well, I'm sorry, but I am going to have to take your car away for a week. You can drive to and from university, but that is it. Naledi: no way. I was supposed to drive people to Umhlanga this weekend to go to the beach. Cobus: I understand you are frustrated, but I am disappointed in your university performance and don't feel you should be able to go 5 minutes later. Naledi feels frustrated, angry, and discouraged. Which of the following appraisals most likely precedes Naledi's level of emotional distress? As described 5 minutes after this conversation, I studied for 4 nights, and can't believe I failed. I am sorry you are disappointed, and I will go call my friends to tell them the weekend is cancelled. I know we talked about this before. I am disappointed as well, and I understand why you are taking my car away. I can change the plans for 2 weekends away, and spend this weekend studying. My friends will get over it. This is the worst thing ever. No one is ever going to want to hang out with me again. I am a horrible friend. Explanation: Naledi's feelings 5 minutes after the conversation show that she is experiencing emotional turmoil. Prior to her period of emotional turmoil, Ellis believed that a person appraises a situation in an irrational way. Naledi stating that this is the worst thing ever. No one will ever want to hang out with him, and that she is a horrible friend is an irrational appraisal.